Hello, I'm Robert, and this time I'm going to debunk this idea that apparently lots of people believe in the United States, that Bill Gates wants to inject us all with a microchip in a vaccine. And so and then it continues that the idea of this microchip is that apparently the government, for some reason, want to keep track of everyone, and they can interrogate this mythical, magical microchip from a distance, and it's got a GPS tracker in it, and the government will be able to tell exactly where everyone is and keep control of you, and sometimes they even say that they can use this magical chip to control your minds and all sorts of crazy stuff. At least it is, it seems, given that 28% and 44% of Republicans come to believe this, then presumably if you haven't got a very strong scientific background, it seems plausible. But it seems very bizarre if you have got a very strong background in maths and science and that sort of thing. So anyway, I'm going to try and explain why it just isn't possible. First of all, Bill Gates doesn't make vaccines, so I'll just clear out a few things. He finances vaccines, but if you go and look at the 169 vaccines, and 30 of them are currently actually in clinical trials, 6 are in phase 3, and none of them are by the Gates Foundation. Some of them have been financed by them, some have been financed they've given finance in order to support them, but they do not develop vaccines. And the Bill Gates Foundation is particularly behind a vaccine alliance called Gavi and COVAX, which is the vaccine pillar of the Access to COVID tools, or the ACT accelerator. And the idea behind this is to give the entire world access to the tools they need to fight COVID-19. So the leading vaccines are developed by particular countries, United Kingdom, United States, China, and so on. And often they're quite kind of nationalistic. They say, we are going to make sure that the first 100 million vaccines, the first 300 million vaccines go to our country. Now, the WHO think it is very important, and important not just for individual countries, not just for the whole world, but also for every country, that we prioritize the very worst hit areas. If say, just take a country at random that nobody's going to be would be very worked up about, except for a very small population. Take, say, Luxembourg. Suppose Luxembourg developed a vaccine, and then they said all the people in Luxembourg have to get that vaccine first. Well, Luxembourg is not going to be safe from COVID-19 for as long as you've got these big outbreaks in the United States, in India, in Brazil, and so on. And the WHO is saying that just as a self-serving thing, what we need to do is to make sure that the worst hit areas get priority access to the vaccine, and the health workers get priority access. So they're saying that we should have a vaccine that is developed collaboratively across all the countries, and that these countries then put in their finance and the risk together, and then they reap the benefits together, and then the vaccine is used universally in all the worst hit areas around the world as a top priority. You don't have them waiting a month before they get vaccines in Brazil, say. Right from the start, that should be a priority. And it just makes sense. And the United States should be a priority because they've got intense community transmission going on. Now, the details of this are yet to be sorted out, but they will sort them out by the 31st of August, the rules, and then we'll see how many people sign it. And United Kingdom is very strongly behind this. I don't know if they're going to be able to actually sign it. We have to see when they've got all the rules sorted out, and then see if it's something United Kingdom feels they can sign. And then we'll see what other countries join it. But that's the WHO's idea, and the Gates Foundation is behind this, these sort of ideas, that it needs to be a public good for the whole world. And it's pretty much the opposite of the philosophy of trying to control everyone. It is giving them things where they're needed, and we'll see this all the way through as we come to what the Gates Foundation is doing. They're involved in empowering the weaker members of the global community. That is their strong focus. And whatever you might think about Bill Gates as an entrepreneur, and I'll come to that later on, as an entrepreneur and what he did in bringing Windows to becoming what it is, Bill Gates is no longer Bill Gates, the CEO of Windows. He stepped down in the year 2000 in order to do his philanthropy for vaccines, probably influenced by his wife Melinda. And together they have developed this foundation which is doing remarkable things to save lives. Millions of lives have been saved by the Gates Foundation. So, yes, they do provide funding for vaccines, they don't develop vaccines. And their aim all the way through the Gates Foundation is fair access to drugs and medicine throughout the world. And they are very strongly involved in reducing child mortality. So, for instance, many children worldwide still die of easily preventable diseases, including ones for which there is a safe and effective vaccine already. And here in the United Kingdom, every child, unless you've got very strong philosophical, religious views, there are very few people who would refuse to let the child be vaccinated against tetanus, against HIV, which can kill your child. It's rather like flu, it's airborne, but it's much more deadly than flu, and you don't get it anymore because of the HIV vaccine. Or hepatitis B. The hepatitis B then in I think in Norway, Sweden, they don't vaccinate against it. The reason is because it's such a limited prevalence there. But when something is deadly, then, and if there's a vaccine that stops it, we have vaccines and we stop it. For some reason, measles, and for some reason people got all worked up about measles, and they thought there was something in the measles vaccine that it would cause autism, which is absolutely not true. It was a very, very bad quality research that was disproved. It was shown to be very badly conducted. And just on the basis of that, which was soon shown to be misconducted, then that set up this whole idea that vaccines are bad for you, and many people now refuse to have measles vaccines based on this improperly conducted, very poor research that has been disproved. And so, sadly, but these people tend to do it just for measles and some related vaccines within that same particular vaccine group, vaccine injection. I don't think there are many people who would refuse a vaccine for tetanus, for instance, or for yellow fever. If you go into a country with yellow fever, which is spread from monkeys in tropical jungles, or for dengue fever or malaria, I don't think many of them would reject all those vaccines too. So it would be so sad. Apparently 28% of the the US population believes this new conspiracy theory. Now, if that led them to refusing the COVID-19 vaccine just like they refuse measles. Some people refuse measles. Now, luckily, we don't need to vaccinate 95% of the population like you need to do for measles. It turns out that for COVID-19, you only need to vaccinate 70% of the population. I've got a thing about that somewhere. It's the R naught. Right, there we are, the R naught, basic reproduction rate. So the natural infectivity of COVID-19 is quite low, 2.5, instead of the 18 that you get from measles. Each person infects 2.5 others on average. What's more, the way COVID-19 works is that most people infect nobody. 80% of the infection comes from 20% of the people. Even partners or husband and wife, they often don't infect each other if you can get to them quickly. And if you can diagnose COVID-19 quickly. But the R naught for COVID-19 is you only infect 2.5 other people on average, and most of that is from super spreader events, where one person infects maybe 20 and then 10 people don't infect anyone. And that basically is a tendency for COVID-19, and certainly most of the time, then most people infect very few. And if you go and look at, say, Singapore, which traced every single case of the early clusters, you can go and look and you get one after another that just don't infect anyone, and one person infects 20. The entire tree is there to look at for the early cases for Singapore. It's quite striking, very unlike flu. So we only need to get 70% vaccinated. Now, if sadly this conspiracy theory is believed, then we could get to a position where 28% of the US population does not get vaccinated. If that happened, and if the vaccine is less than 100% effective, then that would mean that it can't be stopped in the US by herd immunity. So you would have to keep on doing the physical distancing and maybe even occasional lockdowns when the rest of the world is protected by vaccines. And so if you did do that, now actually we should do that. So even when the rest of the world is doing vaccines, they should also be doing the physical distancing, unless it's 100% effective. If it's say 80% effective, then doing physical distancing on top of the vaccine will help it to stop much faster. So if the aim is to eradicate it throughout the world, we should keep on doing everything. We should keep on doing some element of physical distancing, so long as there's community transmission, even if you're already using the vaccine to stop it, until it is gone. So if we're doing it like that, maybe to some extent it won't really matter. If the United States has, say, 50% vaccinated, 50% herd immunity, then it could make up for the rest by doing lots of physical distancing, if necessary going back to lockdown, until you have absolutely got rid of it. But it is so unnecessary, because this rumour is totally false. So now we'll explain about why it's false in more detail. So first of all, the whole GPS idea is, this is a GPS device, a state-of-the-art, used for keeping track of children. So a GPS unit needs a battery. If you want to So for instance, microchipping your cat sadly will not tell you where your cat is. It's only useful if someone else finds it and then takes it in, and then you get the microchip, and so someone else has found it, it's got lost and someone else has found it. But you can't use a microchip of your cat to locate it. We just don't have this. It's not the technology we have. The reason it's remarkable, actually, that GPS works even the size, that size. Because if you think about it, we've got satellites way up in orbit, and you've seen the satellite dishes that you have to get satellite TV. It's quite remarkable that we can fit in something that can get signal from orbit and work out where you are, and then broadcast the signal as well, so that you can then know, so other people can then know. It's just absolutely remarkable what they've managed to put into such a tiny amount of space with modern technology. But there's no way that fits into a needle or a vaccine. So no, there's no way that not with current technology, nowhere near. So now you can inject a normal RFID chip, and RFID chip just basically, it does what it says on the tin. It tells you your ID. It's like with contactless payment. The payment doesn't really go through the chip. The chip just identifies you, and then it's their little machine that does the actual payment. It just does a secure ID. So an RFID chip has very little actual computing on it. It doesn't have any read-write memory on it. So you can't do much computation when you can't change memory locations, not even temporary memory. So it's very, very limited in what it can do. And again, an RFID chip, it's quite remarkable what they can do given the limitation. The other thing is that an RFID chip has no battery. It has no power on board. An RFID chip gets its power from the actual radio wave, the microwave that you interrogated with. And it takes up a little bit of energy from that and uses that to send a tiny, almost like a reflected beam back. But it's actually taking up a bit of energy, and then it's doing a little bit of processing on its hard, no temporary memory. It's a little calculation it does, and it does that to send something back in a way that not only gives you the ID, but shows that it's a secure transmission. It shows that it's secure, and it's doing a secure transmission back to you, showing that it is the ID and it's not faked. So you can inject an RFID into a pet, but you need an absolutely huge needle. A needle is big enough to inject rice grains into you, not like the tiny needles that you use for a vaccine. It would be very, very obvious if a doctor came and tried to inject an RFID chip, and you'd feel a big lump under your skin. It would feel big because we're very sensitive to such things. There'd be a rice grain sized lump under your skin. There's no way that could be done in a clandestine way. If someone was going around injecting everyone with rice grain sized RFID chips, it'd be absolutely obvious. And the very smallest ones we get, it is possible to get a dust grain sized chip, which is rather smaller. Even then, the normal vaccine needle could not quite include it, because it's 400 microns, and that would not fit in 413 microns, which is the very big size of vaccine needle that they put into intramuscular vaccines. And so that is not possible either. And that's because you would need a little bit extra in order to make it protected from your body and stop your body rejecting it. You can't just put the chip in. And the Hitachi chip, this dust grain sized one, then it has integrated antenna. So people say, oh, but you can get tiny, tiny, tiny chips. I know that. You get absolutely minute, nanoscale size chips. But that is not enough. You need an antenna on your chip. An RFID chip needs an antenna to broadcast back again. And this dust-sized RFID chip can only broadcast back a few millimeters. So far from the government, from 100 meters away in loads and loads of little towers that they're supposed to be putting up everywhere to keep track of you, say, or whatever your idea is. That's not going to work. They're going to be able to come right up to you and find the location on your skin where it is, and then put a scanner just a few millimeters away, just directly on your skin, basically. That's not sensible. That doesn't make sense. The only other possibility is that you have an external antenna that so they inject this supposedly this tiny, tiny dust grain size thing into your body, and then they attach an antenna on top that has to somehow join onto it in order for it to broadcast. And that doesn't make sense either. No way that's going to be a secret. So, no way, this just doesn't work. And now there's an even smaller one that actually could fit into a normal vaccine needle. It's 22 microns, which can fit into a very big cell. But it can only be read from 5 microns away. That's 0.005 millimeters, 5,000th of a millimeter. In other words, if you inject it into your body, you've lost it. It's too far away to measure. It can only be measured in a microfluid channel. And this is not something you can buy off the shelf. This is an experimental device that Stanford University are working on. You can fit inside the cell, and you can use it to read the pH inside the cell. And it uses an option of an RFID chip that some of them can alternatively be powered. And they have a little circuit which lets them be powered. And this thing uses that circuit to be chemically powered just for a moment or two. Can't be powered for long, but just a little blip saying, oops, I've got a little bit of power. And then the frequency with which it sends these blips tells you the pH. Or some other thing. It can tell you the insulin content of your blood. But it's no use because you can't put it into your blood. It can tell you the insulin content of if you've got one blood cell in one blood cell or something, that's about it. But they are working away on this. But this anything kind of useful that you could inject is way, way into the future. And so that you could inject through a needle, or that you could put into a cell. And so you've just got the GPS tracker, and that's no use. Not for this conspiracy theory. Now, I just want to talk about some other things that you might see shared. So, this is not the same as tablets with a digestible RFID chip. So, this is a rather cool idea. So, I have some tablets that I'm supposed to take. Let's see if I can find them. Show them to you. Here we are. I have to take these tablets. I have to take 2 of them every day. It's called allopurinol. I'm unfortunately susceptible to gout, and since I've had these magic tablets, then I don't have gout. And it's absolutely wonderful things, absolutely amazing. Keeps my levels down of the urea levels or whatever it is. I think it's urea that gives you gout, and as a result, I don't have it anymore. Now, I'm going to keep on having this for the rest of my life. It has no side effects that I've noticed, and if you have gout and you take these tablets, then your life expectancy is the same as someone without gout. If you don't take these tablets, and if your gout is very severe, then it can reduce your life expectancy. So I'm definitely going to keep on using taking these tablets for the rest of my life. And you can taper down, and I might try that at some stage. And if you do that, then if the urea levels stay low, then you could go off them. But most people just stay on them for the rest of their life. I see no problem. It's not causing any, I don't see any side effects. But I do forget to take them sometimes. When I first got them, I tend to get very sleepy. And so I almost took them as a sleeping pill at last thing at night. The doctor said, oh well, that's no problem, just use them, take them last thing at night. And so I used to do that. They don't do that anymore, I've got used to them. That was an unusual side effect they happened to have on me. Anyway, if we had these digestible Rfid chips, I'd certainly go for them, because whenever I swallow one of these pills, each pill, then it would just do a little blip, because the Rfid, as it dissolves, get a little bit of power from the acid in my stomach, and then it would send out a little blip as a signal, and then if I had some kind of wearable tech, then it could tell me that I've taken my pill for today, and that would really make things very easy. So it's a neat idea, but the important thing is this is voluntary. Nobody's going to force you to swallow an Rfid chip or inject an Rfid chip, but it is approved. And it's again not the same as syringes with an RFID label. So this is just an RFID on the label on the syringe when someone's injecting vaccines. It lets the person who's doing the injection to keep track of how many injections they've made. It is not injected into you. It is just a label on the vaccine on the syringe. So I don't think many people would have a problem with that. That's just they need to keep track of how many vaccines they've used, and this is just helping them doing their administration. So I can't see anybody having any problems with that. Now, the enforced microchips are illegal in many United States already. So optional RFID chips, there are quite a few employees, not that many, it's not that popular, but there are a few, I think mainly small companies, that have optional that you can get an RFID chip injected into you, and then it just takes the place of your smart card. You can use it to unlock your car, you can use it to open a door and buy things at the company's shop, and so some people do go for that. But so far I can't find any stories, and nobody's shared any story with me of any employer who has tried to make it enforced, make it mandatory. Now, you get these clickbait titles, but if you read these articles very carefully, what they say is that they're talking about preemptive laws. Preemptive laws. And so the thing is that in the United States, there are many people who are scared of an antichrist, and they read, this is not in Christianity generally, this is just in the version that is promulgated in the Bible Belt in the United States. And most people like Christianity in the United Kingdom, then all that stuff in the Book of Revelation is very enigmatic, and they think most of it already happened in the 1st century AD. For instance, this mark of the beast thing is probably, it was actually not 666, but some other number, 69, I can't remember the number now, but the original number wasn't 666, it was a different number in the earliest manuscripts, and it was associated with a Roman emperor and with his coins. And so it's quite a natural interpretation is that it was actually talking about the 1st century AD. It's a very natural, fits everything, and most Christians say that's what it's about. But in the Bible Belt in the United States, for some reason, they say this mark of the beast is about the future. Most Christians say it's about the past. And most people in the United States are not aware of how small a fraction of the global Christianity community they are. It's about 5%, I worked it out, that believe in the rapture. And this is rather similar kind of calculation. I would imagine it's the same number who believe in the mark of the beast as a future event. Just 1 in 20 of Christians worldwide have this belief. But it is very strong in the United States, and so really it's just because of this belief that they passed this law. They want to prohibit the Antichrist. And in order to do that, they are prohibiting microchips, because they think that the Antichrist is going to require microchips. So that's basically what they're doing here, preemptively trying to prohibit the Antichrist from enforcing injection of Rfid chips. And for most people outside the United States, that's not a concern at all. Anyway, so these 7 states, California, Maryland, New Hampshire, North Dakota, Oklahoma, Wisconsin and Utah, already they prohibit mandatory RFID chips. So, if someone did come around with a big, huge needle, big enough to inject something the size of a rice grain, and say, you can have COVID-19, but you've got to have it on this very big needle, and I'm not going to tell you, and then you just inject something and you feel a lump under your skin, then they've done something illegal in your state, if you're in one of those 7 states. And then you feel a lump under your skin, then you get an RFID scanner and you find you've actually illegally injected you with an RFID chip. That's not going to last very long. After about the 2nd or the 3rd chip in the Bible Belt, that someone has injected something like that, then they're going to be taken off to the courts. And they're, I don't know, probably imprisoned or something for illegally injecting RFID chips. But no, there's no way this is going to happen. But here are all the countries, all the states where it's already illegal. The pale blue ones, it's illegal for any purpose. The dark blue, it's illegal for employment. The other one is another one. Tennessee is going to introduce a general microchip ban. So this conspiracy is illegal. So if you're in these countries, Oklahoma, you know, it just is illegal in your state already. So now, another thing that comes up is this idea of a nanodots tattoo. Now, these are actually called quantum dots, and it's just a small semiconductor, tiny semiconductor, and if you illuminate it with UV light, so presumably they illuminate you with a small amount of UV light through your skin, then it will emit a near infrared signal. It's totally invisible. So it's basically fluoresces in near infrared. There's certain, like for instance, what is it? There's a certain mineral that fluoresces. Is it calcite? I can't remember. There's a mineral that fluoresces in ultraviolet light. Is it calcite that fluoresces? Let's just do a little. Let's just see if I got that right. Yes, calcite is known to fluoresce in red, blue, white, pink, green, and orange. I never knew there were so many colours for fluorescent calcite. There you are, there's a picture. Oh, there you are, some pictures of fluorescent calcite. And there you are, those are all the colours that the calcite can fluoresce in. I have no idea, I knew it could fluoresce, but I had no idea that it could fluoresce in so many colours. So anyway, so if you shine UV light on calcite, then it fluoresces in invisible light. Well, this is a special kind of copper-based dye that if you if you shine UV light on it, then it fluoresces in the near infrared. I don't know if calcite. If calcite it fluoresces in so many colours, maybe it fluoresces in the near infrared as well. I mean, it fluoresces in red. Why not? It fluoresces in red. Maybe you could just inject a little spot of calcite. I don't know. Anyway, I'm just guessing. No, maybe I'm not. I shouldn't say that. But it's like calcite. It's basically like putting a little bit of calcite in your skin, but it's a little bit more high tech. And instead of fluorescing in red, yellow, orange, blue, or green, it's going to fluoresce in near infrared. And then you would. This is not an RFID. It's not your ID. Each person who's got the same vaccine will have the same quantum dot. You're not infecting a unique ID in each person. And this quantum dot would just say you've been injected with COVID-19. And it might say your first injection if there's several, and a second one with a quantum dot that said you've been injected with your booster. Except there's no way this is going to happen for COVID-19. It just can't happen in time. It's not even very likely, I don't think. But you get loads and loads of these things. Like you watch Tomorrow's World for the 1970s, and you have these inventions that never came to anything. And this is a bit like a Tomorrow's World invention. It was financed by the Gates Foundation, but they're just interested in ideas generally. I think it's incredibly unlikely. I mean, it's so error-prone. Maybe they will. But you would have to have loads and loads of different quantum dots for every vaccine you have. And then you would interrogate it with your shine UV light, and you get a little constellation of infrared dots. And from that, they'd work out, which one, and then you'd have to disentangle the ones that you need. I mean, presumably it could work, but it seems a bit far-fetched to me. Anyway, and they say you could have a little extra information about the date of the vaccine administration and the lot number of the vaccine batch. So every day they would have to make new quantum dots for that date, and then they'd inject those into the people they're injecting on that date. So why did they do that? Well, I don't think I've explained. It's needed for the millions of people who have no medical record, and they tend to miss out on their medicines. Now, the Bill Gates Foundation is definitely interested in a digital ID, and they have actually funded ID 2020, which helps children and people who don't have an ID to have a digital ID. Now, you almost certainly already have a digital ID, at least with your health system. It doesn't need to be online. You go and some kind of ID where you go and see your doctor, and then you have to move to a new doctor. Then he can access your old records if you give, and find out your past history. So you've got an ID, a digital ID. In the UK, it's in the NHS health system. Then everybody's got their ID and they can be accessed. So most people don't have any problem having a health ID. And then I've got my passport. Most people would have a driving license. I don't drive, but most people have a driving license. And so you've got photo IDs, and then if you need to prove yourself online, you can just scan it and then show it to someone. So you can very quickly establish a digital ID online if you need one. Now the problem is that there are 1 billion people in our 7.5 billion people in the world. Of those, 1 billion people have no birth certificate, no passport, no driving license. They don't have any registration on any polling register. They are not eligible to vote because they have no way to prove that they exist to their own government. So there are many people who are severely disadvantaged because they don't have a digital any form of ID. And then when it comes to health, vaccination, then as a child, they won't get their tetanus, their HIV, they won't get their meningitis injections, because there's no way to check whether they've got the vaccine already. Well, they do find a workaround. Health workers do inject people even though they haven't got an ID, but it's very muddly and confused. They did manage to eradicate smallpox, and loads of people didn't have an ID for smallpox. So there are workarounds for this, but it's so much easier if people have got a digital ID. So, and that includes 20 million people, children, who don't have any form of ID. They can't prove who they are. They can't prove they exist to their own government. So that is where the Bill Gates Foundation comes in. Again, it's the opposite of what people make them out to be doing. They're caring for the disadvantaged. They're empowering the disadvantaged. They're giving people who can't vote the ability to vote. They're giving people who can't access health care, who can't get it by a health record, the ability to have a health record. If you're in a village and you can't prove you haven't got a birth certificate, how do you get a health record? You just can't. Not on any health system, because how do you prove that you are who you are? So this is the idea of a digital ID. So nowadays, everyone's online. Even people who can't prove they exist are online. Can't prove they exist to their own government. So, and even if they're not, then they've got a friend who's online, or they've got someone in their village who's online, and they can go and get a digital ID, and the digital ID is attached to their fingers, not injected, not actually physically attached. It is just that their fingerprint can be their way of proving they exist, proving their identity. Use their fingerprint on your modern smartphones often let you register your fingerprint, and then you can prove. Then you've got an online ID, and so that is why it is linked with COVID-19. They're not going to manage to have this tattoo is never going to be ready for COVID-19, even if it is approved, but they may be able to make some use of digital IDs. And it's not for any ulterior purpose. It's just so that you have a health record, so that they can check whether you, especially if you've been injected already with COVID-19 or other vaccines, and if it needs a booster, it will be especially needed. You might need a booster after 1 month. So you go around all the villages, giving them the first shot. And then, in order to have, so some of them think, some of the vaccine, the Oxford vaccine, has a much stronger immune response if you give them 2 doses a month apart. And they don't know yet if the second dose is required. But if it is, then the health workers in sub-Saharan Africa will have to go around all these villages, giving people a vaccine, and come around all the villages a month later and give them the second dose. To do that, they need to know if they've been injected the first time. Well, if they haven't got digital ID, they'll just have to ask them and say, did you get injected by COVID-19 vaccine a month ago? But digital ID is much safer, much more careful way of doing it. So this is the only reason why they want it. And the Gates Foundation is researching into digital IDs, and now the is absolutely privacy protected. The idea that it's privacy protecting, user-centric, and designed for scale, impact, and replicability. Designs proposals, any individual organisation meeting the required application and evaluation, then if you go and look at it. So, and then without the protection of law, if you haven't got an ID, how do you get legal protection if you can't prove you exist? How can you be a citizen? How can you vote? How can you transact if you need? How can you get a credit card if you can't prove you exist? That also is a big problem for many people in the world. They just can't provide the proof of existence needed for a credit card. And then they say digital identity carries significant risk if not thoughtfully designed. We do not underestimate the risks, and then we believe that the individuals must have control over their own digital identities, including how the personal data is collected, used and shared. Everyone should be able to assert their persistence, their identity. Privacy, portability and persistence are necessary for digital identity to meaningfully empower and protect individuals. So that's the aim, to meaningfully empower and protect individuals. It's the absolute opposite of what the conspiracy theorists claim, that the aim is to control and disempower individuals. They're not doing that. They're freeing people to have a voice and control their own destinies, to vote and to access healthcare. And the title of the manifesto may be confusing. They say the need for a good universal digital ID is universal. They do not say there's need for a good universal digital ID. If you have a digital ID already, you do not need a new digital ID. Maybe if they make an especially good, very useful one that works really, really well, and it is recognized everywhere throughout the world, then other people will want it. But it's certainly not going to be forced on you. Most of you have a good digital ID already. I'm already registered on the health system in the UK. I've got a passport. If I did want to drive, I could get a driving license and so on. So there we are. Hope that's a bit clearer. And if you're unemployed in Austin, Texas, so you could have a digital ID in Austin, Texas. It was just a pilot scheme, I think. But these people in there, again, it's the same situation. They have no birth certificate and no poll registry, so they get an ID. Now, oh yes, I just wanted to say, this is a bit of a side thing, but people who get involved in this whole Gates conspiracy theory, who often believe a whole lot of crazy things about Gates. So I just want to say, I'm not going to say he's perfect, but nor was the leader of Apple as well. Name come out of my mind for the moment, but you know who I mean. And I'm not saying he was a perfect, that in always his industry, his way he ran Microsoft, he was a perfect person. But this is a rumor that is completely false. The claim is that, well, first of all, so I'll talk about this first. So people talk about all these chips thing, and they say, oh, he's involved in Microsoft, so of course he's trying to chip everyone. He stepped down from Microsoft in the year 2020. He was mainly involved in operating systems, especially developing early Windows. He was a genius programmer. Many people don't realize that. He's not like the CEO of, he's not like the CEO of some of these organizations. He was highly respected. Indeed, the people who wrote code for Windows, they talked about how they would come to him with very intricate, Windows is very intricate and detailed and very, very complex. I'm a Windows programmer, and I sometimes use the Windows operating system and just the documentation of it and some of the things you need to know about. but he was involved in the actual coding of it, and he was involved in working with the people who coded. And so when he was CEO up to the year 2000, and people would come to him with very technical issues, and they were amazed by how insightful he was. And he would ask them very, very direct and difficult, hard to answer questions. He kept totally up to date with all the intricacies of the complexities. Windows is so complex that no one person can understand it all. Any of these modern operating systems is like that. No single person can understand the entire operating system. You have specialists or experts in different parts of the Windows operating system, and then they work together. And Bill Gates, who was in it from the beginning, had an amazing overview of the entire thing. And no matter what part of the operating system you were expert on, you came and talked to Bill Gates, and he had a good understanding of what you were talking about, which was quite remarkable. So I have a lot of respect for Bill Gates. I'm not saying he's perfect, but he was very ingenious and very clever. And I'm not saying Windows 3 operating system is perfect either. You know, it's very ingenious and interesting. I use it a lot, and I prefer Windows to the Mac operating system because they're always backwards compatible. I have a program written for Windows not backwards compatible to Windows 3.1. I have programs for Windows 3.1 that don't work anymore, but backwards compatible to Windows 98, nearly. If you just tiny things you have to fix, and backwards compatible to XP still, in all details. You have, unless you go into really recon type stuff, and the code still works. So as a programmer, it's a good thing to program for. So Linux isn't like that. Linux is constantly breaking old programs, and so is the Mac. The Windows is the only major operating system that doesn't break old programs. So I commented from a different point of view from other people. To me, as a programmer who cares about whether my old code still works, then from that point of view, Microsoft is one of the best. I'm so glad I wrote my code for Microsoft, because I could never have kept up if I'd written it for the Mac or for Linux. Anyway, so Gates. So anyway, yes, you will also sometimes hear that Bill Gates stole the early code for MS-DOS. That is not true. MS-DOS licensed 86-DOS to IBM. 86-DOS was written by Tim Patterson. So if anyone stole anything, it was Tim Patterson. Microsoft bought it from 86-DOS from Tim Patterson in good faith, and then licensed it to IBM. So Tim Patterson was accused of copying the code, but he said he didn't. He said he just reverse engineered it by reading the manual for this other operating system. That is perfectly legal. Wine reverse engineers Windows, and that is still legal. So you have these programmers that write Wine, which helps you to run Windows programs on Linux. And this is totally legal because they never read the code, the source code for Windows. They only look at the operating manual. And in the same way, Tim Patterson, he only read the operating manual for CP/M. He didn't copy the code. So that's perfectly legal. It's still legal today. It's not just legal at the time, I should say. It's still legal because Wine is considered to still be legal. Nobody's challenged them. And so the question is, was the source code copied? And the answer is it wasn't. Well, it's pretty certain it wasn't, because it's been around for several years now. Back in, I can't remember whenever that was written, back in 1914, I think, 2014 or 1914. In 2014, the source code of both operating systems was made available for anyone to read. And you could check that it was not copied. And so someone did a check to see if it was copied. They said their automatic code checker found it wasn't copied. And nobody since then has found, using manual methods as well, going through by eye, nobody has found any evidence that it was copied. And given the number of people who would love to hit the news by proving that Tim Patterson had copied CPM, then you can be pretty sure that it wasn't. So now, as you say, 28% of YouGov poll, 28% believe this microchip conspiracy theory. And so why do they believe such a bizarre theory? Especially the whole GPS. I mean, if you're not well up on RFID chips and so everything, you might find it plausible that you could inject an RFID chip that could be interrogated from a few meters. That is a matter of techie details. If you check in detail, you find that's not yet impossible. It may never be possible. It depends. They have a big difficulty developing an antenna that can transmit to a sufficiently sensitive detector over a distance of meters. Some things just are physically impossible. And it's not certain yet, but this is physically possible. Maybe it is. Maybe we need a few new ideas and we'll be able to do it. But it doesn't seem physically possible at the moment, because the antennas are too small and the transmitters just don't pick up a big enough signal. Some new idea, maybe they can. Anyway, but the people who believe the whole fully fledged thing of a GPS tracker that you can inject, then you would have to be not very well up on modern physics at all to believe that. So, as I say here, I think people believe this because our technology seems so magical that you can talk to someone on the other side of the world using something you can hold in your hand. It seems absolutely extraordinary. I have this, there's this thing, Sky Safari Pro. You can hold it up and you can see the sky. Hold it up on your mobile phone, if it's Android or iPhone, and it'll show the stars in front of the actual video of the sky itself, using GPS combined with mobile. Does it actually use GPS? I don't know. Yes, it says GPS combined with this ability to stream to take video from a tiny little device you can hold in your hand, and then you can talk to people via. So all that is absolutely extraordinary. It would seem totally science fiction if it was back in the 1970s. You'd think, oh well, everything is possible. They surely travel faster than light now, and they surely have transporters like they have in Star Trek, and they surely have these medical scanners that you just hold to your skin and it'll tell you absolutely every diagnosis that is needed. And but although these tiny devices do exist to let you speak to anyone in the world, the other things don't exist yet. And we don't have our flying cars, and we don't have our hover, whatever you call them, hover thingies, the thing that was in Back to the Future. So I think that may be part of the reason people believe these ideas so readily. Now, say I love Star Trek, Star Wars, Battlestar Galactica, and Doctor Who, and all these things, but they're enjoyable fiction. But for me, with my science background, these things are no more real than Hogwarts. It might as well be magic. If they said it was magic, I would enjoy it just as much. I rather enjoy it when they say it's science, and then sort of fantasize about there being some future science like that. But it's no more connected to modern current science than Hogwarts is, and Harry Potter. We don't have things that can do that. So I often get people contacted by people who are scared of things that are impossible without modern science. And so anyway, the main risk is that you won't be able to that you won't vaccinate enough people. So I hope that this video will help convince a few of you that there is no plan to do this. And then the aim is not, and some people claim that the aim of this is to, there's another thing people claim, is the aim of masks is to get you used to having things on your face, so that eventually you put a mask on your forehead, because the Bible passage talks about masks on your forehead for the Antichrist. And the aim to inject things into your arm is to get used to having injections, so that eventually they'll come along and put marks into your hand. But it doesn't work like that at all. You don't do things you don't get used to, and the aim to be locked down is to get used to being locked down, so you'll be okay to be permanently locked down. People don't like being locked down, they never will. They do it because they have to, because it's necessary for the purposes of health and safety. So the aim of the vaccine is to get rid of COVID-19. Once COVID-19 is eradicated from the world, then we can manage fine without a vaccine. And the WHO talked about that just today, I think it was. No, yesterday. That the WHO said, were asked how this compares with the 1918 flu. They think that we will be able to get over it within 2 years, completely eradicated from the world. They think that's possible. And if we follow the ACT accelerator and the vaccines go to the worst hit people first, then the worst outbreaks will be got rid of not long after we have a vaccine. Within a few months, then there'll be no community transmission in the worst places in Brazil, United States and India. And it makes sense to me that should be your top priority. And the health workers and so on. And the aim for AstraZeneca is that every country will be able to make its own vaccines. But if the aim for the WHO is that the people who are best at making vaccines make vaccines, and then the people who are best at making syringes make syringes, people who are best at making swabs make swabs, and the entire world works together to make sure that we all have everything we need in order to defeat COVID-19 as quickly as possible. That will eliminate it from the entire world much faster than if each country tries to do everything itself. Anyway, so now, even if you've got 28% of usually, I've already said that, you'd still be able to stop it. If you've got philosophical difficulties, do I talk about that somewhere? Yeah, people with religious and philosophical reasons, I think it's very important to respect people who have religious reasons or philosophical reasons or other reasons for not wanting to take a vaccine. You shouldn't impose your ideas on other people. I think that's very important. So the main issue would be if you have an entire community of people who have these beliefs and COVID-19 keeps circulating through them. If it's just individuals throughout society, it's not going to be a problem as long as we can deal with that 28%, as long as we can deal with the infodemic and the fake news. And if you only have the people who have very strong religious beliefs or very strong health reasons, they just don't trust the vaccine for some reason. They're very concerned about vaccines, even if it's based on some misinformation about vaccines originally. If they're scared, if they've got a phobia, if they've got some mental reasons, then this should be respected. Nobody should be forced to have a vaccine. It should be voluntary. I feel that very strongly. So if you are one of those who, for religious or other reasons, don't want to have a vaccine, then you would be best advised to be very careful about physical distancing. But everyone should continue that once we have the vaccine, unless the vaccine is 100% effective. If it's 100% effective, then the people with the vaccine will not need to take any care anymore. They will know they can't get COVID-19, they will know they can't transmit it. If it's, say, 90-95% effective, then if it's 70% effective, depending how effective it is, the more important it becomes that you continue with the suppression, with the other methods of suppression, the contact tracing, the physical distancing, and so on. If you don't take a vaccine at all, you absolutely have to continue that, for as long as it continues in the community that you live in. Once it's completely gone from your community, then no reason really why you need to keep doing anything if everyone else around you is vaccinated, and you don't, and you are not. And I mean, so long as more than 70% are vaccinated, you don't really have to do the rest, but it has to be 70% in your community. If you are an entire community that has philosophical reasons or religious reasons for not being vaccinated, then you will have to continue with the physical distancing, and luckily for COVID-19 that is enough to eliminate it completely if you do that rigorously enough. So that's about that bit. Now what else? Oh, just to say, basic thing, again for people who are scared of vaccines, the vaccines do not linger in your body. A lot of people misunderstand that. They think that if you're injected with a vaccine, that the vaccine stays in your body for the rest of your life. You've permanently got this chemical in you. That is not true. Indeed, the vaccine will be gone days, weeks, whatever. Not be gone with hours. I'm not sure how long it lasts, but the idea of the vaccine is to masquerade as the virus. For instance, the Oxford vaccine consists of an adenovirus from chimps, and they stick a little bit of COVID-19 onto it, the spike it uses to get into cells, and it pretends to be COVID-19. When this is injected into your body, because it's from chimps originally, it won't reproduce in your body. Even if it got into a cell, it couldn't reproduce. It can't get into a cell, and then once in a cell, it couldn't reproduce. And this thing, your immune system will react to this and say, "Oh, this is a foreign thing. This I don't believe. This doesn't look right," and it'll fight it, get rid of it. And other vaccines actually reproduce within your body, and they produce just the spike, not the whole vaccine. It was the new RNA, can't remember what they're called, RNA thingamabobbies. Anyway, whatever they are, they actually have the instructions to produce the spike of COVID-19, but none of the rest of the vaccine. The vaccine is absolutely useless with just the spike of the virus. So if this goes through all the trials and is accepted, it would go into your cells, it would replicate in your cells and produce the spikes, and your body then would react to the spike, say, "Oh, this doesn't look right, this is not part of me," and it would attack it and get rid of it. So within a few days or however long it takes, your body would totally eliminate this vaccine from your body. And then all that remains after that is the memory of how to fight COVID-19. is the same memory it has if it was infected with the real COVID-19. At least that's the aim. The aim of a vaccine is to get your body to fight the vaccine off and get rid of it. And then once it's done that, your body then will remember how to fight the vaccine, and the memory ideally is the same memory it would have if it was infected with the virus itself. Now, the COVID-19 vaccine is covered in glycans, little sugar molecules, and it does that to hide itself from the immune system. So if you were to use the attenuated COVID-19, unless they got rid of the sugar somehow, then it would not generate a very strong reaction in your body, so your body would remember how to fight against it. It wouldn't fight very strongly against it, a rather feeble response. So that's why there's all this question about whether your body makes you immune if you've got COVID-19 already. It's so the vaccines are deliberately made very, very obvious, so that your body fights against it immediately, develops a very strong reaction. They inject you with a huge amount of it all at once, so your body will go boom, move back against it, and that's why you might get a bit of a reaction, a little bit of inflammation. That'll be your body fighting back. And so, but the vaccines, they don't linger in your body. All it lingers is a memory, and leads to a stronger, longer-lasting immune response that you now know how to fight. Some people worry about the safety of the new vaccines. Well, the vaccines were developed with incredible speed. I've got a whole article about that you can go and read if you want. Vaccines were developed with incredible speed, but the reason for the speed is they took huge financial risks. Normally, it goes through clinical sites. It normally takes a while even to get a vaccine for animal trials. You would have to prove that it's a useful one. You'd apply for funding. It would take quite a long while to inject it in some monkeys. Sadly, monkeys need to be tested with vaccines before humans. So with COVID-19, all the funding for the preclinical is very easy to come by. Then the funding for the clinical trials, then that all the vaccines, the WHO have guaranteed that every vaccine that goes through, that needs clinical trials, will be able to have them. That again is very, very unusual. Generally, you would have to pass a very high bar of proving you've got one of the best candidate vaccines in the world for this virus before you'd be one of the ones that's selected for clinical trials. With COVID-19, anyone who develops a vaccine and it goes through the preclinical trials will get it approved for clinical trials. And what's more, there are plenty of people, because in Brazil, India, Mexico, United States, there are many countries where loads and loads of people who have COVID-19 would be all too happy to volunteer to have a vaccine trial, and in exchange, generally, they have these royalty free, that the country that does the trials will be able to make the vaccine. And then the big pharma that have this, like AstraZeneca, are not going to make any profit. They committed, and it's going to be audited and checked, that they are not going to make any profit from COVID-19 vaccines for the duration of the pandemic. That was an agreement they made with the Oxford group. And they have said that they will definitely, they're going to license it to any country that is able to produce it, royalty free. So even if even apart from the ACT accelerator and COVAX, then you have individual vaccine manufacturers that are already committed to make no profit from it. Of course, AstraZeneca, they're going to benefit hugely from being a company that produced one of the successful vaccines, if it is successful, but they're not going to earn anything directly from the vaccine. Just benefit the reputation, benefit people buying all the other drugs that they produce and so on, but they're not going to earn anything from COVID-19. And so these things speed up the financial risk and overlapping new techniques for developing vaccines. So before phase 1, the studies for phase 1, although it was known from the preliminary analysis that the Oxford vaccine was safe, before they went to phase 2 and phase 3, they had nowhere near enough time for it to pass peer review and be published, and all the other requirements that would be needed before they could get funding for phase 2, never mind phase 3. They're already in phase 3 before phase 1 was published. So all this overlapping of the phases and the doing many things at once, and then starting, and before phase 1 was completed, AstraZeneca had signed up with the Oxford group, and they were working and I think even before phase 1 was completed, they had agreements to produce millions of vaccines. And then starting up and tooling up a big financial risk as a result of funding from the UK government, and then funding from the US government, and then funding various international groups. Then you have these capacity. So now AstraZeneca already has a guaranteed capacity of 1 billion doses, and then another 1 billion doses by sometime next year, and they'll have several hundred million by the end of this year. Included already AstraZeneca, if it's successful, then South Africa, Brazil, India, United Kingdom, United States, they're all going to have their vaccines. And Brazil, for instance, will be able to make its own vaccine. I think South Africa will. India will. And India will be able to, as is very known for its production of vaccines, it will export the AstraZeneca vaccine to over 100 other countries. All that is already set up for AstraZeneca, even irrespective of the WHO ACT Accelerator and COVAX and the Bill and the Gates Foundation support. That's already agreed on. And so when this is about how vaccines do work, for any of you who are skeptical, I mean, for instance, just one example, 30,000 newborns died of neonatal tetanus. So a young child in a developed country, and they'll be vaccinated, and you won't get a young child, a young baby, dying of neonatal tetanus. I very, very much doubt if a mother of a young child would refuse a tetanus vaccine, knowing that they risk their child dying in the West. It's only particular vaccines like measles that for some reason the anti-vaxxers focus all their attention on. And just before the COVID-19 vaccine, there was an outbreak of measles in Samoa. 73 people died, and many others were under ventilators in hospitals. That was reduced because of a reduced vaccination rate. So again, I'm trying to persuade those of you who might have got convinced of this. I'm not trying to persuade any of you who have religious or philosophical reasons for not wanting to be vaccinated. I'm just saying this for those of you who come to believe through the infodemic of of such ideas. Please, please don't believe these absolutely ridiculous conspiracy ideas. If you get vaccinated with COVID-19, you will not be injected by any kind of a chip. It is the only reason why they want to roll out COVID-19 around the world is to eliminate this disease and to get back to normal. And the governments, just like you do. And the WHO, Dr. Tedros, the leader of WHO, wisely and with a lot of foresight, before, very early on, in February, March, early March or something, before much of this had even begun, he said that we have to be careful, we must quarantine politics. He said that long before Trump said any of his stuff. He said we must quarantine politics. He said that we need solidarity, we need people of opposite sides on the political spectrum to agree with each other, with people to work together with the politicians and with their governments. We need to have this development of mutual trust about COVID-19 between people and the government. Governments trusting communities, both ways. Not just communities trusting governments, but governments to trust communities. Here in the UK, I think there's somewhat of a lack of that the government doesn't trust communities. They have this top-level thing for all the, for instance, communities could have been involved in contact tracing, such as happened in Ireland. In Ireland, they had very effective contact tracing. In England, they don't, because they don't empower communities to do the tracing. They try to do it top-down with this company, which apparently, if you are a contact, they just ring you up and you say, "Hello, are you a contact? You should isolate. Will you isolate?" And the answer, yes. That's the end of it. If you do it properly, then the contact tracers should be ringing them up every day and say, are you isolating? How are you? Do you have any problems with isolating? And things like accessing food and so on. And that is how it is done, if you do it properly. And you should go back and back and back to the original contact and remind them again and again, because people forget. Anyway, I'm getting distracted. So we need to work together. The governments have to trust communities, communities have to trust governments. It has to be open. We have to do it without not secretive. Oh, I've gone and undo close tab. Got rid of it. Got rid of the thing I was talking about accidentally. Never mind, it'll come back again. Yeah, those were all the calcite, illuminated calcite things. That's what the tattoo is about. They're not people talking. Although you will see these if you go to visit the thing. But right, so that's it. I think I'm about finished. And it is possible to eradicate this from the world. Anyway, I will update this. This was rather long. I didn't mean it to be so long, but hopefully some of you will enjoy this. There will be a few things I haven't encountered yet, I haven't covered. Do read my blog post if you like. If you're interested to find out more, I give links for everything. And just a shout out for the Doomsday Debunked on Facebook. If for those of you who want to help debunk, important that it is fact-based, for COVID-19 we have a strict rule that infodemic posts are not permitted. For the Doomsday Debunked group on Facebook, you have to be sourced to a legitimate source, to a peer-reviewed academic resource, or to high-level peer review, or the WHO, the CDC, the NHS in the UK, someone like that. And anyway, so we help by fact-checking and debunking these things. And do join the group if you're good at that. You can also join the group if you want help with something you are scared of. And for anyone scared of anything. Anyway, do be sure to read the rules at the head of the group before you join, if you join the Doomsday Debunk group. Anyway, I will stop this now, and hopefully some of this will be helpful to some of you. And I won't be surprised if we won't get a lot of people sort of shouting at me on the comments saying, yes, of course it's... But anyway, I hope this helps some of you, to understand that really, truly this conspiracy theory is completely untrue. So at the beginning of this, nearly a third of the people from the United States, if you came across this randomly via YouTube, then one can imagine probably more than a fifth, maybe as much as a third, getting on for a third, and if you're Republican, more than that, then you might have started this off by believing this rumour. I hope by the end of it that maybe some of you will realise that this is scientifically impossible. And I hope some of you will come. It would be great if this helps some of you to not be so concerned about the idea of being vaccinated. Oh yes, one last thing I said. One last thing. I do need to mention this. So the 3 vaccines, the 5 altogether, 2 in phase 1, 2 vaccines in phase 1, Vaxart and Stable Tech, and both of those could conceivably be available by the end of this year if they went through it rapidly. And there's so many vaccines. With 6 of them, normally, of those 6 that are now in phase 3, normally only 2 of them would get as far as phase 3. 4 of them would have dropped out by now. So it's been an extraordinary level of success of the vaccine so far. Not a single vaccine has failed clinical trials. As the clinical trials have continued, even though no vaccines have been approved, it's been striking listening to the WHO, the Q&A, the press briefings and so on. They've got more and more optimistic about us having a vaccine. I think it is because of the complete lack of any vaccines failing any of the stages of the process. So they have to be very safe. To have 30 vaccines, and none of those 30 vaccines have failed any of the safety issues, safety tests. All you're passing phase 1. I don't think all of them have passed phase 1 yet, but I would have to look up. But the 30 have entered clinical trials. Many, more than half, I think, have passed phase 1. The ones that started earliest have all passed phase 1. The very earliest ones are all the way up to phase 6, without a single, and this means phase 1 means it's safe for young people and people who hate. Phase 2 is a much wider group. It also tests whether there's an antibody response of some sort, and they've been quite effective, strong antibody responses, neutralizing antibodies, killer T cells, or everything you would expect from a good vaccine. And then there are now 6 of them in phase 3. And there seems an excellent chance. Indeed, I worked out that there'd be a 0.001% chance that all 6 of those, even going by typical success rates for vaccines, which is 84%, to go from phase 3 to approved. Then you would expect 5 of those to be approved. And it'd be extraordinarily unlikely for only one of them to be approved, and for none to be approved is next to impossible. We can't make that direct conclusion directly, but I've noticed the WHO becoming more and more confident. They're now just about certain. They say, we expect a vaccine. You never heard that a few weeks ago. And so I expect a vaccine, and then if you're going to have one, then with 169, all of them supported all the way. of the ones that are in clinical trials. And they don't even seem to have failed in the clinical trials. Now, there is a history behind that. It's still 169. It's not dropping down to 50 or something. So they just seem to be progressing through. Now, you would almost think that they picked them knowing they were going to succeed. Now, there is an element of that. The thing is that they have 10 years' experience with SARS and MERS, which are both very similar to COVID-19. And don't worry about COVID-19 mutating. The MERS vaccine candidate is very striking for that. MERS frequently goes from camels to humans, lots of independent outbreaks. Every time the resulting MERS outbreak is the MERS vaccines would still be effective against them. So the coronaviruses don't mutate very easily at all, even mutating in camels and then hopping over to humans again. Still, the MERS vaccine is so stable. So we can expect COVID-19 vaccine to be stable. And then with 10 years, the very early vaccines for SARS, then they were appalling. There were vaccines that attacked the animal hosts, destroyed their lungs. So if this was happening back then you would expect a very high failure rate. You would expect 90% to fail probably. But we have these 10 years experience with SARS and MERS, and from this experience of these vaccines, it seems that has paid off. They have developed insights into the science of how it works, not just trial and error. They have very thoroughly understood how the SARS and MERS coronaviruses work. And they have developed approaches to making vaccines that are specifically targeted to this very detailed, exact understanding, not just of the structure of the vaccine, but of how they work, of the virus, but how they work. Very intricate details. And then, with extraordinary rapidity, they worked out how COVID-19 worked, how it got into the cells, exact processes in the body that it was using to get in, exactly which cells it was attacking, how it was doing it, every stage of how it infects the cell, how it reproduces itself. So it's this ACE2 receptor. It pretends to be something useful to the cell. It triggers this ACE2 receptor, which produces a little vacuole, which comes into the, which is like almost like a little chauffeur-driven car that kind of escorts the vaccine, escorts the virus into the cell. Then it opens out. Then the cell reproduces itself using the cell machinery. Then that makes it, manages to construct itself another little car, as it were, which then escorts it out at high priority out to the cell and starts infecting other things. And that is a very complex process. Every single stage of that process already. They know all the details of how it works and how it goes out again, even though it was completely novel. The way that COVID-19 enters is different from the way SARS and MERS does it. The details of that process. It's all figured out. You can find detailed descriptions of how this works. Then, as well as that, then they developed these antibodies. They developed first of all, they sequenced it with absolutely extraordinary rapidity, days. From having the vaccine, they sequenced it within 1 day. And our handheld devices called the MinION, nowadays, they have these tens of thousands of gene sequences of COVID-19. They have the imaging of it, very detailed 3D imaging of it. They can also gene sequence it. Well, this thing can gene sequence the entire genome of COVID-19, a little thing you can hold in your hand. You can sequence it in 7 hours. Absolutely extraordinary. then you sequence the entire gene sequence. And then you have these. I mean, if you told people in 2000 when they sequenced the human genome for the first time using these labs full of computers, they would be absolutely amazed and astonished by what we can do today. Absolutely extraordinary. The little thing you can hold in your hand. It is absolutely astonishing. And then the PCR tests. People talk about PCR tests glibly, but they developed the PCR test so early on. Then they developed the antibodies and tests, and now they're just about to develop antigen tests. Now, I don't know about these things, but the experts tell me it's absolutely extraordinary that they've got as far as that just within weeks and months, got as far as antibody tests and even antigen tests. Apparently they're hugely challenging, and they already have them. And then they have these lab tests, which will probably make it much faster than you could just do them from the saliva. Extraordinary scientific things going on. Anyway, so one of these extraordinary things, vaccines need to be stored at ultra-low temperatures of -50 degrees centigrade for many vaccines. I think the Oxford vaccine will need to be stored at -50 C. So you can imagine that causes problems. Until the very last thing, you put in the vaccine and you put in the vial and then inject them. But storing them around until they fill the vials, they'd have to be -50 degrees C. And you can imagine, having a cold storage chain from the manufacturers in India or South Africa or wherever, Brazil or whatever, all the way to someone in sub-Saharan Africa, way out in the desert. That is quite a challenge. And they can rise to that challenge, and then all the glass with the syringes and so on. So WHO are working. Oh, I didn't realise that was visible. So we got the time for everyone to see. Anyway, so the WHO have. I usually move that onto another window. Anyway, so the WHO have worked out how you can do that. And the WHO have contacts around the world, even North Korea. There's the WHO office in North Korea. They're trusted everywhere. And that is why it was so impossible for them to go and criticise. They can't criticise Brazil, can't criticise China, can't criticise the US or UK publicly. They criticise all of them privately. But when various countries ask the WHO to publicly blame or criticise one or other country, they can't do that. Just not permitted. And the reason is because if they ever did that, these people would never trust them with confidential information ever again. And they have the confidence of all these countries and the supply chains and the offices in them throughout the world. And so the WHO are able to do this, manage the distribution of it. The UK, there's no way the US is going to be involved in charge of distributing vaccines to China and North Korea, but the WHO can. So it is certainly possible to vaccinate the entire world, but it's so much easier. And the WHO have already got the experience of doing that with smallpox. By the way, talking about North Korea have an excellent vaccination program. Actually, authoritarian regimes tend to be very good at vaccinating. Not too surprisingly. Anyway, the WHO have so there's this possibility that you could accept, that you could receive this in tablet form, and there are these 3 companies that are capable of doing it. The thing is, the tablet form, you don't inject them into the blood. They have to be accepted into the saliva and or into your stomach. That's quite a challenge. And in order to do that, then they have to have something in the tablet that can kind of replicate and get it into your body. Now, that can be safe. It can be something that can safely do that. There are ways of doing that safely. So, things that are absolutely safe to your body, that can go around and just deliver it to all the cells very nicely, to enough of the cells, so that the cells then start reacting to it and attacking it, fighting it off, defending themselves, just like any other vaccine. So there are one famous example, which sadly didn't work very well, is the vaccine for polio. But it did work. It did exactly what it was supposed to do. So there's the attenuated polio vaccine, and then there is the other one, which is disabled, which was invented in 1950. Very clever idea, which then spreads from one person to another through a vaccine that is disabled. But then it turns out that this particular one can flip and can turn into actual genuine smallpox. No, genuine polio, sorry, not smallpox, polio. And so this is a big problem. It just causes a few cases around the world. And the Bill Gates Foundation is involved in funding a replacement to that, which would be just the same. Just research into it. It would be just the same, but totally stable, so it can't flip. But because remember this whole thing about not being able to keep track of who has had the polio vaccine. So one solution is just to make it something that replicates. You just give a tablet to one child in the village, and then they get this. Essentially, it infects them with a completely innocuous, attenuated version of polio, which they then give to the other children in the village, which then completely protects the entire village from polio. This was responsible for saving thousands, millions of deaths. So many people very quickly vaccinated by that. But then they had this nitty-gritty thing, there's just a few left over, that these just tiny little outbreaks, sadly, of just one or two people from time to time. And then they have to attack them, they go back and just give them the original, I can't forget, Denton or something, his name, began with D, I forget his name. Anyway, they gave this vaccine, 1950s vaccine, we still use today. And they still do that. So there was a transition from that 1950s vaccine to the attenuated vaccine. And there was the plan that the entire world was going to use the attenuated vaccine. And then that would have completely eliminated polio from the world, at a point where there were just a few dozen in the world. And then the idea was that throughout the world, in a coordinated way, the entire world would use the attenuated vaccine, which is the injected one. But, very sadly, they didn't succeed in synchronizing it like that, because of the distribution chain and the funding and this whole thing about keeping track of who's had it and so on. And so the WHO, with great reluctance, went back to using the replicating vaccine for polio. And that then is why the Bill Gates Foundation, the Bill and Melinda Gates Foundation, was involved in funding a replacement of this 1950s polio vaccine that is capable of replicating it around the village like that, protecting everyone in the village, but very stable, like the coronavirus. It was very, very stable, not capable of mutating. This is still under development as far as I know. But if we can manage to completely eliminate COVID-19, then the WHO have mentioned this is a huge beacon of hope to the entire world, because there are about a dozen vaccines that we could eliminate from the world, diseases we could eliminate from the world. Now I have a list. I have a list of them here. I have a list of them here somewhere. Anyway, the more than a dozen these are vaccine-preventable diseases. And then I have another list here. So all these things have safe and effective vaccines. All those things. Now, not all of them are perfect. So influenza isn't perfect. And you couldn't really eliminate influenza from the world. But quite a lot of those could be eliminated, and tetanus. But quite a lot of those could be eliminated from the world. There's a whole list of of diseases that can be completely eliminated from the world. I have a list of them here. And let's see, I've got this list here. So the WHO say that there's a huge, let's see, do I have a list? Which is have completely been eliminated. Well, that's Sabin's virus. That was the polio one. Oh no, where's my list of vaccine? Anyway, so measles could be eradicated from the world, and rubella and congenital rubella syndrome, those could be eliminated from the world. Malaria is eradicated from a large part of the world. Rinderpest is eradicated already. Those could be. All those could be. And several others. That's the whole polio thing I talked about. Yes, here we are. Polio, kidney worm disease, lymphatic filariasis, that mumps, rubella, and then several others here. Malaria, trachoma, river blindness, and you're also underway. Don't mention hookworm, and the 9 diseases that could be eliminated, and the several others from the International Task Force for Disease Eradication has looked at several others that can be eradicated. Now there's some that can't. Rabies can't because of the animal reservoir. Yellow fever can't because of the animal reservoir. But there are many diseases that can. So COVID-19 could be a beacon of hope to the world. We can eradicate COVID-19. That's pretty certain. Then, so then I was just going to explain, yes, so these, I've said it, I think, these 2 tablets, it took me a while to find it. So these 2, vaccines in tablet form. So the 2 that are in phase 1 already, and we may have those by the end of the year. And there may well be others. So oh yes, I don't think I've said that. So the advantage of those is that they, these tablets, then these tablets can be kept at room temperature, and they don't need needles. They don't need to be injected. You can just eat them. And so you don't need anyone skilled to distribute them either. So this would make it far, far easier to eradicate COVID-19 from the world. So if you're afraid of vaccines, even if you're just afraid of a needle, that's your only reason for wanting to refuse a vaccine and not accept it, then do bear in mind that the WHO also want to develop tablet vaccines. This is by far preferable to the injected vaccine. So, and this completely goes against this conspiracy theory idea as well. If there was this conspiracy theory to inject you with microchips, there wouldn't be this huge effort to develop tablet vaccines. And there wouldn't be all these people saying, tablet vaccines are brilliant. We wish our vaccine. The Oxford people, they just wish their vaccine could be delivered in tablets form. So it is possible. So I think, personally, just due to the extraordinary success rate so far, and all the knowledge also the understanding as to why that happened. It's almost certainly because of all the knowledge we have from the SARS and MERS vaccines. I wouldn't be surprised if 2 months from now we have 6 vaccines for COVID-19, and that by the end of 2020 we have 30 vaccines. It may well be that all 30 that are in phase 1 trials now are actual vaccines by the end of this year. If that is true, and that would include 2 tablet vaccines already, then we can pick and choose between the ones that are most effective, the ones that stop transmission. Some vaccines just stop the disease from attacking you, but don't stop you transmitting it to others. They basically turn you into a symptomless spreader. So some vaccines might be like that, so we can just eliminate those. So the very first vaccine will be incredibly valuable. So if AstraZeneca's Oxford vaccine works, even if it just turns you into a symptomless spreader, even if it is just like that, that will just be amazingly wonderful. And there will be thousands, millions eventually, people vaccinated, just frontline health workers. Injection with this vaccine, and they know that they're not going to become sick. They still will be taking the precautions. They don't want to infect people. Then if the Oxford vaccine, which I expect that to be the first to be approved, because they were so far ahead of everyone else, all the way through, they've been way ahead. I expect their announcement any day now. Indeed, that is why I'm doing this today, because I wouldn't be surprised if by the end of August that AstraZeneca announce that the Oxford group announce that their vaccine has been approved. So that's why I'm saying this today. I expect within a few days they may well say that it works. It's not impossible. And so not to raise your hopes too much, because they may say it hasn't worked. It's also possible that all 6 of those vaccines fail. That will not mean that all the vaccines are going to fail. Remember, we've got 169 coming up behind. If it was typical, then only one of those would fail. But if there's some big barrier in the last step that we don't know about, then they might all fail. It's not impossible. And then, based on those failures, looking at the vaccines that fail, how they fail, what exactly happens, then the vaccine makers are going to be able to learn from that. And they'll realise this one is a very priority vaccine to develop. And they may even develop new vaccines based on that. But I'd be very surprised if that happens. So then we're going to be just picking and choosing between these 169 vaccines. There might even be 169 vaccines by sometime next year. But I wouldn't be surprised if there are 20 vaccines by the end of this year. Now I know I know somebody's going to be listening to this video end of this year, and there's only going to be one vaccine. They're all going to say, "Oh, look at him, silly fool." But I'm just being optimistic, as I'm being cautiously optimistic, just like and going a little bit over what the WHO say, but just based on just the most straightforward, obvious way of interpreting what is happening, then we can expect lots of vaccines by the end of this year. I'm not saying we will. It is too soon to say that. There's many a slip between cup and lip, or whatever they say. But it's certainly looking very promising so far. And so then if that does happen, then almost certainly the vaccine that is used to vaccinating the entire world will be in tablet form. Pretty much certainly. If it is as effective as that, and if we have 20 vaccines by the end of this year, I would be very surprised if the vaccine that it vaccinates the entire world is not in tablet form, because it has such huge benefits. So, in that case, if you're worried about microchips, then they're just going to go out of your, go in and out of you. You know? What's the point of the microchip that you're going to excrete later that day or a few days or a couple of days later? So hopefully that at least will help some of you, even if you're still believing this microchip theory at the very end of this, even after everything I've said. So anyway, hopefully this helps some of you to be less scared of the COVID-19 vaccines and have other ideas about it. And I'll stop.